I'm here as a surgeon to speak about the SMP, the scalp micropigmentation. This is a kind of technique that is here to stay, and speaking as a surgeon, I can consider from different point of view this kind of technique. The first appearance in the International Society has been during the conference in Capri in 2010, and since 5 years old I was one of the first to introduce in my practice the tricopigmentation. I'm using the tricopigmentation with two main purposes in my practice. When I have to wait the results of the therapy before an operation, so I want the patient to see something before the results of the therapy and in advance to the results of the transplant. And second, I can use the tricopigmentation to enhance the result of the hair transplant. So you can say, so it's a waste of time, because if you are doing a transplant, which will be the reason to do something more? So there are many reasons. So the patient is not always ready with the perfect results after only one operation and could not do the second operation in a short time. In that period, tricopigmentation will be perfect to hide the transparency of the scalp. It is frequent that I'm telling to my patient that they have an extraordinary capability to individualize the single spot and the single scar on their scalp. Even if anybody, the girlfriend, the mother, and me are not able to see which kind of scar they are looking for. So the scar for them is clearly visible. And this is a perfect indication for tricopigmentation. They feel that the surgery leaves a bad sign on the head, and so they want to hide completely. So when they are not more capable to see the scar, they are really happy, and so this is a very good option for tricopigmentation. What I want to say is that tricopigmentation is not something that came out of the blue, but has a long story. It starts, as I told you, in 2010, and is a combination of research on instrument, research on pigment, and strong application by a woman, Milena Lardi, that introduced a special technique in how to do tricopigmentation. So it's not a magic wand that appears in our practice, but it's something extremely valuable that you can understand, that you can follow in history and also in this future.